Dr. May again, Mini Health Talk to get you healthy again. Today, we're going to talk about multiple sclerosis. So the cause of multiple MS is unknown, but an immunological abnormality is highly suspected. The other thing is latent virus, and since a lot of MS are happening in the families, so genetic susceptibility is also one of the causes. So for the pathology of MS is very simple. It's plaques and islands of demyelination. You can see on this chart here is demyelination with destruction of oligodendrolia, so the cells, the nerve cells, and perivascular inflammation in white matters. So simple. So that's pathology is very simple, but the cause is kind of hard to know. So symptom and signs mostly happen paresthesia in one or more extremities, weakness and clumsiness of a leg or a hand. Visual disturbance, some of the patient experience, but not everyone. Difficulty in bladder control, and some of the severe cases may be involved, but mostly they don't involve in that. Depression is more common too, and fatigue. Next page. So the acupuncture treatment, so we are mainly focused on, number one is to improve the brain blood circulation. Number two is to strengthen the heart and kidney. So you make heart and kidney strong, so your body cells have better nutrition and less toxins. The cell were deteriorating slower or stop deteriorating. Number three is clear away all the factors which could trigger the autoimmune chain reactions. More often it's upper respiratory infections, so that's why we have to do something for that. So the brain blood circulation is 20 to get the qi up, and the motor center to stimulate to the motor control center for the nervous system to function normally instead of eating their myelin sheet. For the heart and kidney strengthens pericardium 5 and 6 and heart 7, and UB23, that's back through and point, and UB7 and heart and kidney 3, 6, and spleen 10 and 6. For the autoimmune triggers, decrease the autoimmune triggers, we do the 3 yellows, that's massa tones points to get the toxins out of you. Large intestine and 4 to strengthen the digestive system, and lung 7 and to make sure the upper respiratory is good, and in combination with the large intestine 4. Liver 3, use the liver to clear the toxins. Stomach 36, large intestine working together to strengthen the digestive system, and also GB 34 and 39 to clear up the dampness in the gallbladder channels. So for the Chinese herbal medicine treatment principle are the same as acupuncture. So for brain blood circulation, 补阳还五汤, that's used for the stroke patient, but nowadays I found out it's great deal for the brain blood circulation to restore the brain functions. For the to strengthen the heart and kidney, the 四逆汤, 左归丸, 右归丸, and 毛冬青. And for autoimmune triggers, to decrease those autoimmune triggers, 银翘散 to clear up the upper respiratory pathway. 普济消毒液 to get any virus and toxins out of the system. 八正散 白芷, this work together usually for urinary tract invasions of the germs to trigger the autoimmune reactions. Next one. So now we're going to do a case study. So although for the MS there's no cure so far, but in my clinical experience we have been improved so many MS patients muscle strength, and stop them worsenings. But I haven't cured any yet. I treat them, have emissions, they don't need a treatment, but I haven't cured anyone yet. But I always, when they come to me, I can do the acupuncture herbal treatment. I'll be able to improve their situations. So this case study, the 15-year-old white female came to me with complaints of left side arms and legs weaknesses, especially in the summer. So MS usually is worse in the summer. Do you know why it's worse in the summer? It's just like a wiry conductivity. When the wire doesn't have the wrap into it, when it's hot, the conductivity is getting even less. Okay? Frequent urinations, fatigue, and easy to fall due to the left side weakness. Her neurologist diagnosed her MS for a CT scan. So you usually in the CT scan, they can see the lesions in your white matters for the myelin sheath areas. Her tongue was red and thin with sublingual vein dilation 30 degrees, so the heart kind of weak too. Pulse was deep, thin, and weak, so it's all showed up the weakness, pulse and the tongues. So my Chinese medicine diagnosed kidney and heart qi deficiency. So acupuncture point, I use dual 20, 四神聪, right scalp motor center, large intestine 10-4, this is kind of typical. 三焦 5, ring 12. You don't have to use all these points at once. 6-4, and stomach 25, and mastone 3 yellows, stomach 36, spleen 10-6, and liver. So I just use this alternatively. Mostly I choose about 10 to 12, sometimes even 14 points. Alternatively to, but I never skip the dual 20 decisions when I right motor center. Those are always like a must. In Chinese herbal medicine, I use Buyang Huanwu Tang 30 grams to improve the blood, bring blood circulation, and Sini Tang 20 grams to strengthen the heart, and the Zuogui Wan 20 grams to tonify the kidney, and Yin Qiao San 30 grams to clear the pathway for the trigger points of to trigger the autoimmune reactions. After 3 months treatment, patient's muscle strength was improved. Then I decreased the number of the treatment monthly. 15 years later today, you have to remember the MS patient I've been treating for 15 years. Patient is still able to walk with the mild muscle weakness. What's a great work for the Chinese acupuncture done for the patient. Next. So as far as the patient follow the treatment plan, 90% of patients, so I see so many MS patients, 90% of patients should be able to stop the progressions of MS. And the other 10% should require the comprehensive approach to stop or slow down the demyelinations. I want to thank you again for joining me today to discuss about MS, acupuncture, and Chinese medicine treatment. If you have any questions, please feel free to leave a message under a comment area. And if you like our program, please give us a thumb up. If you want to learn more of my program, please subscribe my channels. We'll be able to deliver this periodically to you. Thank you again. We'll see you next time.